Welcome to another episode of Clinic Success Secrets, the podcast where we uncover the strategies and insights that drive clinic growth and elevate patient care. I'm Tommaso Dwyer, the founder of Clinic Success Partners, a medical digital marketing agency dedicated to helping clinics serve more patients and achieve the success that they deserve. With a background in biomedical engineering and digital marketing, I'm hoping to bring my own perspective into these conversations and learn from each guest about how they're leveling up their healthcare businesses. Today, it is my great honor to be joined by Dr. Tim Romanowski, a board-certified family physician specializing in direct primary care and sports medicine. Dr. Romanowski is the co-founder of the Warrior Medical Group, a practice that focuses on holistic patient care, hormone replacement therapy, and select aesthetic treatments. After transitioning from a hospital-based system, which he will be sharing on the podcast today, Dr. Romanowski built a successful direct primary care practice that emphasizes quality over quantity and patient relationships. Dr. Romanowski, it's a pleasure to have you here today.
Thank you for inviting me on.
So before we dive into everything else, could you share a bit more about your journey getting to where you are today, and what that transition looked like from working in the hospital setting to the Warrior Medical Group?
Okay. Yeah, absolutely. So let's just take a couple steps back here. I did the whole medical school thing. I actually went to a foreign school, Ross University, because I got waitlisted at the University of Maryland for about 2 years and I was just tired playing the game. So I did my schooling at Ross University, did 2 years of surgery residency up at St. John Hospital in Detroit, Michigan, followed by family medicine residency. I switched over, found out surgery was not for me. Went to Altoona, Pennsylvania, Altoona Family Physicians for my family medicine residency, then went on to WVU, West Virginia University, for a sports medicine fellowship. So after a long journey of education, came back home to the Maryland area to practice, be near family. And I started working for one of the local hospital systems. Clinic was owned by the hospital. Originally had 3 docs there and 2 APPs, so physician assistants. And slowly everyone started peeling away for one reason or the other. Retirement, moving on to different jobs. And then COVID hit. And when COVID hit, it was myself, my one partner, and a PA. We had a nurse practitioner with us for a very short term, but quickly part ways. My partner retired February of 20, and then the lockdown was March of 20. So almost like she knew it was coming. So when she retired, I inherited all her patients and all the other patients that were in the practice. The hospital asked that all of our APPs be redeployed back to the hospital to help in that case. So I took on her patients as well. So I'm trying to care for this entire patient population by myself, especially during a lockdown, and just becoming more and more frustrated, burnt out. If I've seen patients, I had to travel to a designated area about 90 minutes away from where I live, see patients in the morning, and then be back in time at my house to do televisits. Once they started lifting up the lockdown restrictions here in Maryland, the hospital consolidated my office with 2 other offices closer by, just because the one office had a larger footprint and didn't feel like bringing back staff members to try to be a little more cost efficient, I guess they were doing. But still, the burden was there. All these patients trying to keep up with the demand, answering phone calls, messages, all the administrative headaches of paperwork with a skeleton crew, and reaching out for the hospital, for support, and always being told, "Oh, you're not seeing enough. You're not doing enough to make revenue." It's like, well, I'm only one man. I'm standing 2-3 hours after my last patient, after my last staff member leaves to get caught up for the day, and I'm still being yelled at by the hospital, by patients. I'm just not responding. So this took a big toll on me. I started doing burnout scores. Really, my scores couldn't get any lower. And unfortunately, part of that was suicidal ideations started coming up. So yes, I was having thoughts. What really shook me out of it is one day my wife came to me in tears and said, "I don't like the man they made you." And that really hit hard. And so realizing that, yeah, I was spending my time with my patients, not with my new family. So I had to make a change. I approached one of the nurse practitioners at the combined office and brought up the idea of, hey, I want to get out of primary care. I'm really interested in hormone replacement. I started looking into it for myself, and I think it's something that I could do to actually help people. But she convinced me to stay in primary care because we were doing so much good work for this population. It's like, yeah, but I can't do it for the hospital anymore. This is just not right. I know what you're going through. You're under the same stresses. So I was talking to one of my co-residents, and he told me about the direct primary care movement. So I looked into it, really liked the idea of actually being able to practice medicine the way we were intended to. Patient relationship first, and then treat without restrictions, being told how to treat by insurance companies, by hospital administrators, people who've never stepped foot into a clinic or worked in a clinical setting, all run by algorithms. Like, no, this isn't patient care. Why do I need to bring back somebody 5 times for multiple problems I can handle in one session? The only reason why I'm doing this is because I'm chasing insurance dollars. So after convincing her that direct primary care was probably the way to go, we took the leap of faith and started the practice. And since then, my burnout scores completely flipped around. Um, Patients seem to be more satisfied because they know they have access to us. They can call, text, send us an email, and we can handle things. And patients come in, they're scheduled for, a 15-minute appointment. I don't know the last time I actually did a 15-minute appointment because it always runs longer, just getting to know the patient better and taking care of whatever their needs are at that time. So that's the beginning of the journey that we're on right now.
Nice. And first of all, commend you for making that transition. I know that couldn't have been easy, kind of betting on yourself, the truest definition. Um, when making that transition to the direct primary care model, what were some of the biggest challenges that you encountered making that pivot?
The biggest challenge is, first of all, I'd say financially, because I am leaving a steady job. My partner was leaving a steady job, guaranteed incomes. Like, but what good is the income if I can't take care of myself? I can't take care of my patients. So that was the biggest scare. Still is, because we're still building. But it's something that had to be done, and glad we did it. The other hurdle, is just trying to convince people of the importance of the model. Because the question is like, why should I pay this extra fee to come see you when I'm paying for insurance? Well, my question is, what does your insurance get you? The only thing it says is, yeah, you have access to a doctor. That doesn't, when it takes you, 3 months to get in for a regular appointment or 3 weeks for same day sick call, what is that? That's absolutely nothing. So we were sending my old practice, because of how overloaded we were sending people to urgent cares, emergency rooms, just to be treated for simple things, which we could have handled. But that's what the insurance company was doing to us, is forcing us to jam so many people into such a small period and only take care of one problem at a time, bring people back, just chase those insurance dollars. So once we get people to realize the importance of actually building a relationship with their doc, with their clinician, and then saying, hey, I have access, text me, call me. If I don't have to bring you in, I'm not. And patients actually are opening up more, especially my male patients. Have had great conversations with them. We've solved more problems, and it's actually given me opportunities to sit down. I can think of one patient that I had been seeing for about 6 years at my old practice, working up the same thing month after month. And she finally came in, we sat down, we were just having a conversation, and she said something or did something that I never noticed before in my 20-minute appointment I had with her before. And that turned out to be the key to what her diagnosis was. Something I just missed because I didn't have the time. Now I have the time for my patients.
That's powerful. And I suppose when it came to actually making that transition, how did you get that initial traction with the new patients in terms of marketing, putting your name out there, what did that look like?
So initially get that, yeah, when we left, we had a good staff, that from my old practice, and they actually did help. It's like, hey, Dr. Romanowski left. I hear he went X, Y, and Z. Like, or, look up this website, not really saying where I was. And that's how people started finding me. People were reaching out. I put up our website, people started searching that way. So it was very organic to begin with, just word of mouth, people trying to find me. As we started to gain momentum, we turned around and was like, okay, we need someone to help us with this. Because, we're seeing the growth, but we're not growing as fast as we probably should. Granted, I see a lot of direct primary cares. They'll sit around with about 50 patients for about 2 years, just struggling to get by, and then slowly build up. We were able to bring over probably about 150 patients right off the bat from our respective practices. We first went into, met up with the Chamber of Commerce, and then just looking to local resources, realizing I had connections mainly through high school in the area, for marketing teams or people who knew how to market, or just reaching out to friends, family. That was the big thing. We signed on with the marketing team, got some momentum, then shifted gears to another marketing team, and that has really picked up.
Nice. And fast forwarding to today, what is working for you guys? Where do you think the biggest opportunities are?
So what is working for us? I think once we got a better social media presence, unfortunately, I don't have the time or the knowledge to really do a lot of that stuff.
Or patients?
Or patience. Yeah. So that really helped getting something really scheduled on that. And then the other thing was just marketing, or doing networking, different groups that start bringing patients for us. Teamed up with like physical therapy groups or other providers in the area. It's like, hey, we need a new primary. This is the way to go. This is the way of the future. So really, the grassroots word of mouth has been our greatest success. Yes, we do events for some of our aesthetic stuff, but it's not the big pool that our word of mouth is.
And I suppose when it comes to leveraging word of mouth, are there any particular strategies that you've been implementing to build trust and grow your practice, or is sort of a case of trying letting the great work speak for itself?
And I think letting the work speak for itself is the big thing. But then we look at, but we are also asking for Google reviews, those types of things, which does boost the word of mouth. We have patients who are in different Facebook groups for different communities. And anytime, like, hey, we're looking for a new primary care. We were going to this practice. Things have changed. And I see so many of our patients start throwing our name in there right away and just getting us, the praise, which is helping us, and that's really the word of mouth is just people getting out there telling their friends and family what the next option is. The other thing is, the other word of mouth is we've made friends with some of our different reps who will go out and see someone or a friend like, hey, get in with this group. They're going to help you. And it's just a developing relationships, not just with patients, but our community members too. And that has really helped.
And in terms of then, I suppose, when you're growing the clinic, obviously we talked about the patient acquisition. Obviously, we need to take care of the actual fulfillment and operations. I know it's not easy. So from my personal experience and also the experience of our clients and our previous podcast guests, actually scaling the operations of these types of business is often the real challenge. As the actual operator, generally you'll delegate the marketing to some specialists. And I know a lot of the day-to-day then becomes people management. When it comes to actually scaling the operations, what are the biggest operational challenges that you faced, and how have you tackled them?
The biggest operation challenges. So right now, it's staffing for us. We started off with just two of us. It's myself, my business partner. Her name is Valerie Wallace. She's a nurse practitioner. And then we did bring on someone to help answer phones, but it was very spotty. And it's like, okay, we can do this. We can do it ourselves. We're running the business. We will do the legwork. And now we're getting to the point where, okay, we're a little bit busier. It's hard to answer the phone calls, those types of things. So we brought somebody else in who's doing that about 2 days a week for us, which is helping. And then just reorganizing, managing the office. When I say managing the office, I mean like ordering stock and those types of things. Um, so those are the big things. And myself, we went out there and started talking to other providers, and actually we just hired on a podiatrist who's interested in the whole direct care model. So that's one big challenge, is that scaling that way. The other one is being conscious of our budget. Um, we had an idea of how many patients we needed to see to hit our break even point. Started hitting that, and then we started saying, okay, what else can we offer? And that went into more of the aesthetics. So now it's budgeting to pay off that equipment, plus, the everyday operations of the office. And then it's trying to keep ourselves afloat, personally too. Because we realize the business comes first, our staff comes first before we get that paycheck.
Yeah. Yeah. It's a big difference between revenue and what you're actually putting in for.
Exactly.
It's very, very different. Something that people don't always realize, but yeah, cash flow is the big one. In terms then, I suppose, of expanding these services, you've obviously, I know you're doing a lot of work with, products like BTL, things like that. How do you balance expanding these new services, like different aesthetic treatments, while staying true to your original primary care mission?
Right. So when we start expanding our services, one of the things we talked about is like, we don't want to lose our identity of who we are. And that was, we are primary care clinicians, primary care providers. So we focus so heavily on that part. Yes, sometimes it does suffer on the aesthetic side. It's like, okay, let's shift for a little bit. Let's talk about the aesthetics. We can get people in for the aesthetics. We can talk about the clinic and then convert patients that way. Yeah. So what we're finding is people like this one-stop shopping, basically. Hey, I can see a primary care doc. Oh, you know about hormone replacement. Let's do that. It's like, oh, you know what? You can take care of some of the aesthetics parts for us without having to send you to a plastic surgeon. So we're trying to wrap it all into one big bundle, big package for patients. Hey, why go to multiple places? We can take care of that for you.
So it makes some more sense. I think definitely, as I mentioned before, the way we approach our own digital marketing is, focus on the who, not the how. And I think if you can just have your avatar and really, really address all of the different challenges that they have, you're in much, I suppose, stickier position, for lack of a better word, but also you can really, really know the ins and the outs and the pain points that they're going to come to you. So I think that makes sense. I think the aesthetic solutions that you specifically offer at Warrior Medical Group do a really great job of reflecting that. I suppose when it comes to then the finances, you mentioned cash flow obviously being the big one. You're growing the team, you're balancing that act of paying off new equipment. It's not easy, to say the least. But what are the biggest financial lessons that you've learned about from running a direct primary care practice?
Biggest financial lessons. One, it doesn't happen overnight. Yeah. Despite the promises from every single rep I've had in here for the different devices, oh, you'll make X amount in such time. No, not so much. It's a grind. We know where our stable income comes from, and it's that care that we give to our patients who are signed up for their membership, their recurrent payment every month, so they have access to us. And then, like I said, we had an idea, okay, we need X amount of patients to break even. Now it's like, okay, how many more patients do I have to add so I can still break even? Yes, we've been in the red for this year, which is sorry, in the black for this year, which has been great for us. But yeah, it's still that downside. It's like, how fast can I expand? What is my budget? What is my potential income? But what is the reality? And that's where we always have to take a step back. We've been wined and dined by several different companies for different devices, and really just being strong. It's like, ooh, that's really, really neat, really sexy looking. We can do that. And like, you're like, no, we don't need that right now. Maybe a year, 2 years down the road. It's like, so what is the here now? What is the next step? What is the future plan? And really what we're thinking is, we want to expand our services to a greater area. We do have several of our colleagues who are really interested in the model, who are just tired of the whole game and system, who want to join us. And we're just waiting to pull that trigger. And they always say that there's no perfect time. The perfect time is right now. So but we're just waiting for something to give us that push to do it. And so that's the big thing is, what is that push? Is it financial? Is it our availability? We just have to figure out what that is.
Nice. And then I suppose bring back to the here and the now, as you said, you've made all these changes, you're growing at the rate. Yeah, there's a metaphor I'll give, but it's a bit of a crude one. But there's a Warren Buffett quote that talks about this. The idea being is that there's a finite growth rate at which certain things just take. The metaphor I'll give is, you can't cook your dinner in a tenth as long by just putting the oven on 10 times as fast.
Right.
It just takes time. I know. You can optimize it, but you always have to be impatient with the inputs, but patient with the outputs. That's fundamentally what it is. So ignore the finance side of things for now. Anyways, you obviously mentioned that you made this transition on your end for a reason. There's burnout, there's all these sorts of things. Bringing it back to the here and now, how does it look today? I know obviously nobody has it perfect, but I'd love to hear about the personal benefits you've enjoyed from this transition.
Personal benefits. One, I have time for my family. That was the big thing for me. When all this was going on, my wife and I, we had our first kid during COVID, and that's when all my energy was zapped trying to take care of patients. I couldn't take care of my family. Happiest time of my life, I couldn't enjoy it. So by switching that focus, that has helped so much. And I came to the realization that if I can't care for myself, I can't care for anybody else. And as a caregiver, I fall in that role. I have to care for everybody. I come second. No, we have to realize that we come first. We should be first. So I got to take care of my health, my mental health, take care of my family, then my patients. And that was a whole paradigm shift for me, for my partner as well. And it's made the difference. We can now set boundaries. Patients are respectful of those boundaries because they realize, hey, this is something I have to pay for. I need to respect him as a person now, not just, oh, here's my card. The insurance is going to cover it all. Like, it has brought back humanity to us. And it also has developed really good, strong relationships with our patients. And that was what we were missing. That's what we wanted. We have a quote up in here, and it's, if you listen to a patient, they'll tell you what's wrong. If you listen a little bit longer, they'll tell you what they want. And if you listen just a little bit longer, they'll tell you what they need. And unfortunately, in today's microwave society, run everything right now, we never get to that need. We only take care of that want and move on. But if we can get to that need, we can solve so many more problems. And that's, I think, the biggest personal gain that I've seen.
Love that. Definitely going to quote that. With regards to again, we've talked past, we've talked about the present, and now the future. What is your vision of the future for the Warrior Medical Group?
So, vision for the future, we want to expand. Like I said, we've had several docs who are very interested in joining the practice. So I see really good potential getting this model out there to even more patients, increasing access even more, and getting doctors and other clinicians to come in and practice the way we were intended. That's the goal. That's the future goal, is spread the word about this style of practice and how to build a relationship. Um, yes, also expand the aesthetic services, the financial aspect of it, but that comes secondary to the actual mission of just good quality patient care.
Yeah. No, and the proof is in the pudding right there. So I think beyond that, then I suppose the industry as a whole, you know, how do you see the actual direct primary care model itself evolving over the next 5, 10 years?
Sure. I mean, when we look historically at the direct primary care movement, we see that actually it has a lot of cost savings across the board, mainly for patients. When I was working for the hospital system and doing the insurance thing, we realized that all these cost saving measures had nothing to do with patient outcomes. It was cost saving to the patient. It was always to the insurance company or to the hospital. When you've had insurance companies telling you that you need to go talk to your specialist and say, you need to change the way you're practicing, you're too expensive, I'm going to stop referring to you. It's like, I know that there were. They charge those fees for a reason that makes more sense. Why should I go to something that's going to save the insurance money instead of giving good patient care? Or actually got yelled at for making too many referrals when I made one. It just snowballed from all the specialists. So yeah, that's one thing. And then when we look at the actual health costs, when you realize that national average, there's about 10 hospital administrators per physician, that's outrageous. Why are we having all these administrators who have no idea how to run a medical practice, running medical practices, telling us how to practice, medicine? That's where all the healthcare costs are going. It's not physician salaries or anything like that. It is the administrative burden that they create, that the insurance companies create. So if we can change that whole thought, get back to a more simpler form of medicine, be the hometown doctor, the local doctor who knows you, not just your chart, that changes the way, people perceive medicine, the way we interact with medicine, and we start doing a healthcare revolution. But patients and providers take back control.
And I've no doubt for anyone that's listened to this, they're going to be inspired. I mean, they should hope they are anyways. But what advice would you have for a physician that wants to start or is considering starting a direct primary care model? What pointers would you have?
Sure. Actually, I just had this conversation with my family doc. He's taking care of 3 generations of my family. And he's like, I'm burnt out. I should have called you months ago when all this was going on. And it's like, the pointers. One, have faith in yourself. You have the skills. You went through medical school. You know what medicine is. 2, it is a leap of faith. I was told once, you can't discover new lands without losing sight of the shore. So get out of that comfort zone, make the jump. It's going to be better for you. It's going to be better for your patients. I think those are the big points. Do your research, know what your market looks like, know what you can handle personally, and then give it out to your patients. Medicine is all about, it's really paying it forward. I have the knowledge, let me pay it forward to you so we can make your life better, improve not just the number of years, but the quality of those years.
Help more people, as I
I
would say.
Yeah.
I love it. Listen, that being said, Tim, where can people find you and more about what you do online and offline?
Sure, yeah. Offline, we are located in Annapolis, Maryland. Our website is www.warrior-medical.com. It has links to our Instagram, our LinkedIn, and our YouTube channel, as well as our Facebook group or Facebook page. Has all of our services listed there. So that's the easiest way to find us.
Right. I love that. And I know we've said it before, but any last single piece of advice for someone that may be struggling with their own burnout while running a business? What would that be?
For the burnout issue, first of all, find a mentor, someone who can help you through it. Find a confidant who you can talk to free of judgment about those mental struggles. That's one thing I did. I reached out to some very close friends, and they helped me through it. And then just believe in yourself, believe in the process. It does get better.
You're an inspiration, and I appreciate it, Tim. Hopefully, we'll do this again.
Yes. Thank you.
Yes.